Hi there, good morning. Dr. Krishnamurthy here once again. Thank you for your positive response in my series of infusing knowledge in the very lighter vein. Of course, if you like, you can always subscribe more to my videos. Today I wanted to talk to you about the external carotid artery. The artery which supplies the outer aspect of the head and neck. Not intracranial, that is the internal carotid artery. Everything outside of the cranium is supplied by the external carotid artery. Earlier we had seen the lower part of the neck supplied by the subclavian artery. Those unknown branches hitherto. The transverse cervical artery, deep cervical artery, suprascapular artery, dorsal scapular artery, all of them supply the bulk of the lower third of the neck. The external carotid is in charge of the middle third and the upper third of the neck, as well as the scalp, entire scalp. It is given off at the level of the thyroid cartilage, commonly known as the Adam's apple. At that level, the division starts from the common carotid. It goes under the mandible, deep in the substance of the deep portion of the parotid gland. And as it exits the gland, it divides into its two terminal branches, the superficial temporal and the maxillary artery. From down, it has got several branches. The branches upwards are the superior thyroid artery, the first one. It descends down, going to the superior pole of the thyroid gland. That is the first artery to be ligated during a thyroidectomy operation. Then comes a small branch called the ascending pharyngeal. It goes medial and posteriorly to take part in the pharyngeal plexus. The lingual artery is next, supplying the tongue, which is a very vascular structure. Then comes the facial artery. Facial artery curves, is in relationship to the submandibular gland, and is the artery of importance for the anesthetist. While holding the mask, one finger is always held against the mandible, feeling the pulsation of the facial artery. And it supplies the 2/3 of the face. Various branches. If you want to know, you can always go into the details in literature. Then there is a big branch which is called the occipital artery, which goes posteriorly under the sternomastoid towards the occipital area to take care of the occiput and the suboccipital area. A smaller branch called the posterior auricular artery also is given off. The two terminal branches are also very important. The superficial temporal artery. The commonly palpated pulsations here are that of the superficial temporal artery. You can even feel your pulsations of the throbbing superficial temporal artery pulsations in the case of a vascular headache. The artery goes under the zygomatic arch and supplies the entire lateral aspect of the scalp. Frontal branch, deep temporal branch, the parietal branch. Then the thickest artery is the maxillary artery. Often perceived by medical students and others, a very difficult artery to learn about. Once you know what area it's supplying, you'll be able to derive most of the branchings also. It is the artery of the deep aspect of the face. It is the artery of the deepest portions of the head, extracranially. That is the palate, the orbit, inferior aspect of the orbit, and the deepest portions where the craniofacial junction occurs pterygopalatine area and all. So if you know that is the place it is going to supply, you can derive most of the branches as well. Of course, anatomy books describe first part, second part, third part to be more in detail. The first part branches are the deep, auricular, anterior tympanic, middle meningeal, accessory meningeal, and the most important artery is the inferior alveolar artery, which is going to enter into the mandible, going to come out through the mental foramen. The middle part of it is purely muscular. There are very powerful muscles situated here of mastication. Masseter, pterygoids, buccinator and all this. So the branches also derive the names. Pterygoid branches, this side and that side, buccinator, masseteric, deep temporal branches, posterior and anterior, are the ones. And the deepest, the third final part, supplies the palate, the infraorbit, pharynx. So are the branches. Posterior superior alveolar, infraorbital, spinopalatine, descending palatine, artery to the pterygoid canal, and pharyngeal branches. This is in short to summarize the various branches of the external carotid artery. Once you apply yourself this way, you are able to remember better and make anatomy, the geography of the human body, a more playable surface. Thank you for listening once again, and please don't forget to subscribe if you have liked. That's more important for me to continue this process of education. Thank you.